Hi, my name is Stephanie Fraser. I'm a lung surgeon and I'm very fortunate to work at Guy's Hospital, which is one of the largest lung cancer centres in the UK. We've specialised in robotic-assisted surgery, and what that involves is us using a surgical system where we sit at a console and we use tiny instruments to perform precise operations. Traditional lung surgery involved a big cut around your side, and it involved us having to spread the ribs, and that was associated with a lot of pain and a more difficult recovery. And in some patients, unfortunately, it led to chronic problems. But increasingly, as we've moved to minimally invasive surgery, so that's small cuts, still being able to perform the same operations with the same quality, it means that patients can get back up on their feet much quicker. So it means less time in hospital, quicker recovery back to normal, and I think that's what matters to patients. There are a number of different types of lung surgery which lend themselves really well to a robotic approach. So when you have early stage disease, one of the big advantages of robotic surgery is that it can help us do lung sparing surgery. So that means that we can take away the diseased piece of lung but leave all your healthy bits of lung alone, and that can help you get back to normal quicker. When it comes to more advanced disease, one of the big advantages is that we can do more complex operations keyhole, and that means that potentially when you've got more complex lung cancer, you can still have the procedure done minimally invasively without needing to have a bigger cut, and that will help you recover better and potentially be fitter to go on and have other treatment to make sure that you've got the best overall care. So the main benefits of robotic surgery is smaller cuts, which can mean less pain, quicker recovery, so that can mean fewer days in hospital and less time getting back to the normal activities that you love. There's some evidence that having robotic operation means that there's less blood loss and less complications, and overall you're getting a good quality cancer operation in terms of your long-term ability to fight the disease. There is good evidence that from a cancer perspective you're getting a good quality operation and you're not losing out compared to bigger open operations when it comes to having a good quality cancer operation. As we start to get more and more familiar with robotic surgery, the time it takes to do the surgery is quicker and quicker. And you can see that the less time patients spend in the operating theatre, potentially the quicker they can get back on their feet afterwards. Certainly compared to a lot of the bigger operations with big open cuts, you can see how there'd be an advantage in the long term in terms of speed, as well as the precision and the accuracy and the reduction in the trauma to the tissue in the patients. So increasingly, especially with things like lung sparing surgery, we're seeing people who can have a minimally invasive operation and get back up on their feet quicker and could be in hospital even just a couple of days after major surgery. I think it's really important that our patients feel empowered to ask their surgeon about the benefits, the risks, the alternatives, the options that are available to them and what support is being in place. I think it's really important that they understand that the robotic system doesn't replace a surgeon, but it's an adjunct and it still needs to be part of a holistic approach to how we manage patients and treat them with care and kindness, and make sure that the entire journey from start to finish is aligned with their values and their goals. I would want patients to know that lung cancer treatment is getting better and better every day, and they have access to new treatments that wouldn't have been available 10 years ago. And so it's really important to have those conversations with their surgical team and with their oncology teams about what might help improve the overall quality of their care.